HIV. How to care for a child. HIV can be treated, so it is important to identify HIV as early as possible. The first step is to assess a child to decide how severe their signs and symptoms are. You can then take the next steps to care for the child. Keep in mind that a risk of HIV or signs and symptoms of HIV are generally moderate or severe and not mild. For both a moderate and severe illness, the child needs to be referred to a health facility. Let's start by looking at when a child has a moderate illness and what you should do. As HIV can be passed between parents during sexual intercourse and also from a mother to her child during pregnancy, labor and delivery, and breastfeeding, it is important for both parents to know their HIV status. If they do not know their HIV status, refer them to a health facility for HIV testing. If they know that they have been negative for HIV, but they have recently been exposed to a person with HIV, refer them to a health facility for testing again. If the child is at risk of HIV, they should also be referred to a health facility for testing. This can occur if one or both parents are living with HIV, but the child has not been tested, or their mother is living with HIV and not taking antiretrovirals or ARVs, or not taking them properly and the child is breastfeeding, or their mother is living with HIV and mixed feeding the child in the first 6 months. If the child has been prescribed ARVs or HIV prophylaxis but is not taking these medications properly, refer the child to a health facility for testing. Explain to the family why it is so important that the child takes their medications at the same time every day for the rest of their life. Always take the opportunity to counsel the family on how to prevent the transmission of HIV, especially from a mother to her child. For family members who have not been tested for HIV, explain the importance of testing. If a person tests negative, discuss how they can stay negative. This includes using protection if a partner's HIV status is unknown or positive to prevent transmission. All people with HIV should be treated with ARVs. If the parents or child is living with HIV but not taking ARVs, refer them to a health facility to get treatment. If anyone is taking ARVs, explain how critical it is to take them properly and what will happen if they do not. Ensure that they have enough of their prescribed medications or are able to get them. As HIV causes the body to need more calories, poor nutrition makes HIV worse. So, it's important to help your patients get enough good food to help their bodies stay healthy and fight illnesses. Explain that they should eat a balanced diet with a lot of energy foods and fruits and vegetables. A child may also have signs or symptoms that may be related to HIV. If the child has any of these, refer them to a health facility for testing or treatment. These can include delays in growth and development, or weight loss or a yellow reading on the mid-upper arm circumference or MUAC tape, or frequent infections, or persistent diarrhea or cough, or oral thrush which causes white patches in the mouth, or frequent rashes. Let's move on to when a child has a severe illness. If the child has severe signs or symptoms that may be related to HIV, refer them urgently to a health facility. These can include a cough with difficulty breathing, or persistent diarrhea with severe dehydration, or persistent fevers, or stunting or wasting, or headache and vomiting, or fits or convulsions. HIV also causes the body to use more calories, and so the child may become malnourished. A red MUAC reading may be a further indication of HIV infection and is also a danger sign, so refer the child urgently to a health facility for assessment and care. In summary, if a child is at risk of HIV, not taking their ARVs properly, or has signs and symptoms of HIV, they should be referred to a health facility for testing and/or treatment.